All right, let's talk about something that's frankly a huge blind spot in retirement planning. It's a misunderstanding that could literally cost your family everything. And it all boils down to what Medicare will, and maybe more importantly, what it absolutely won't pay for when it comes to long-term care.
So let's just jump right in. The big question is this: will Medicare actually cover your nursing home or assisted living costs? You know, you've paid into the system your entire life, right? So it's natural to assume the answer is, yeah, of course. But the reality? Well, it's way more complicated. And honestly, getting this wrong can have some massive financial consequences.
And that assumption that, of course it will, is a really dangerous myth. We all kind of think of Medicare as this ultimate safety net for all our health needs as we get older. But that's exactly where the problem starts.
To really get this, we need to understand a specific term: custodial care. Now, this isn't about doctors or surgery or prescriptions. We're talking about help with the basic, everyday activities of life. You know, things like bathing, getting dressed, eating. This is the kind of hands-on, long-term support that most people eventually need, and it's the one thing Medicare just wasn't designed to cover.
Okay, so keeping that idea of custodial care in mind, let's pull back the curtain and look at what Medicare actually covers. This is where that myth we talked about just smacks right into reality.
So here it is side by side. On the left, what Medicare does cover. You see things like short-term skilled nursing care, but that's usually right after a hospital stay, or hospice for a terminal illness. Think of it as coverage for a specific medical event. Now, look at the right side. This is what it doesn't cover. Long-term custodial care, extended stays in a nursing home, assisted living, memory care, nope. And here's the problem. The vast majority of what people need for long-term care falls squarely into that right-hand column. That's the gap. It's huge.
And even when Medicare does help out, it's really limited. The number you have to remember is 100. That is the absolute maximum number of days Medicare will help with skilled nursing facility. And that's only if you've had a qualifying hospital stay first. Then on day 101, the benefit just stops. It drops to 0. You are on the hook for 100% of the cost. It's like walking right off a financial cliff.
So, if Medicare's help is either not there for most things or it's super temporary, what does that really mean for your wallet? This brings us to the, well, staggering true cost of care.
Just think about this for a second. $90,000. And that's often just the starting price for a single year in a nursing home. For a lot of folks, an expense like that can wipe out a lifetime of savings in just a couple of years. It's crazy.
And it's a pretty similar story if we look at assisted living. You're looking at an average of over $50,000 a year. That's another massive out-of-pocket bill that Medicare simply will not touch.
A lot of us hope to get care in our own home, right? We think it'll be more affordable. But even that comes with a really steep price tag. A home health aide can easily cost $40 an hour. So if you need someone for just, say, 4 hours a day, 5 days a week, you're already looking at over $40,000 a year.
Okay, I know, these numbers they're daunting. But the whole point here isn't to scare you, it's to get you prepared. So let's pivot away from the problem and start talking about the solutions. Let's explore the options you actually have for long-term care. So here are the main ways people handle these costs. You've got Medicaid, but to qualify for that, you basically have to spend down almost all of your assets first. Then there are private options like specific long-term care insurance or even life insurance policies that have special riders for this. And of course, there's always paying for it all out of your own personal savings, if you've saved up enough. But what happens if you do nothing? If you just don't have a plan? Well, the risks go way beyond just money. I mean, yeah, you'll pay out of pocket until your savings are gone. But you also risk losing control over your own choices. You could place this huge emotional and physical burden on your family, and you might leave nothing behind for your loved ones. You see, this isn't just a financial issue. It's a family issue.
So this all circles back to one really simple but powerful idea. You've got a plan for your future, and you have to do it proactively.
So who needs to be thinking about this like right now? Well, if you're somewhere between 40 and 70 and you have some retirement savings you want to protect, that's you. If you want to make sure your spouse is okay financially, or if you don't have family nearby who could step in as caregivers, a plan is absolutely critical. And it's especially important for women because on average, women live longer, which means they're just more likely to need this kind of care down the road.
At the end of the day, understanding this huge gap in Medicare coverage isn't supposed to make you feel afraid. It's meant to empower you. It really all comes down to this. Planning now gives you choice, control, and protection. Just relying on Medicare for your long-term care, that's a gamble, and you're betting your life savings. So the real question is, What's your plan going to be?